Good morning, Loganites. So today is Nurse Practitioner Update 22, or Student 22. I'm still not a nurse practitioner, but a lot of things have happened this week. So it's Thursday. It's Thursday, March the 9th, and we're getting ready to go on spring break this Saturday. So the opioid conference was only last Friday. So we had the opioid conference. It was like a Saturday of studying. Sunday, I do church all day Sunday. Whether it be I go to the 9:15 service, I go to a small group after that, and then we come home. We usually play a little bit. I studied, clean up the house, get ready for work the next day, and then we go to community group, I think is what they call it, that afternoon. So it's kind of like an all-day event for us. That happened. Monday and Tuesday were sensitive exam skills day. When I say sensitive exam skills, I want you to think of like butthole, penis, vagina. Think about that kind of stuff. That's what we're going to be getting into. So with that, they started off with how to have those conversations about sexual health. And that when you start as a practitioner level, the majority is the way I'm feeling about it, is the majority as your communication with your patients is like the biggest part of your job. Because anybody can suture, anybody can cast, anybody can do these small procedures. We're not going in and cutting out bones or doing anything like that. We're not a surgeon. So at this level, a big part of our job is just being able to have that conversation. Just being able to open the door and then us be a partner in care. And I say partner in care very specifically because when I think of my role as a nurse practitioner, it's not for me to sit here and dictate to you what is the best thing for you. We all know what it is. Don't smoke, don't drink, lose some weight, control your hypertension, control your diabetes. We know that. You can look up exactly what the best thing to do for you is. It's pretty straightforward. Now, there is like some nuance in like figuring out, do you have some thyroid issues? Do you have this? Do you have that? How do you manage? The basic knowledge stuff, sometimes you do need help, and you go to an expert because they know already, right? So if you need help with your diabetes, I'm your guy. If you need help with, an ankle, a broke ankle, I may not be the person you want to see. So anyways, therapy communication about these kinds of things, about sexual health, about these sensitive exams. And that's what the whole day is. How do you get into that conversation? The lady that's running the majority of the day one, and it's all about vaginas the first day, is like an older lady, and her whole practice has been involved with postmenopausal sexual health. Okay? It's interesting. It really is, because there is a lot of stuff that never gets asked. Like, a great point that she made that really stuck with me is how many drugs are there for male sexual health? You think about Viagra, you think about Cialis, you think about all the other names that I can't even think of. She said there's basically like 72 different drugs for male sexual health. And when I say sexual health, you're talking about like low sexual drive, does your penis work, that kind of stuff. 70 medications. She goes, up until 2012, how many drugs do you think, or whatever year it was, how many ever drugs do you think there is for female sexual health? Now, I don't know about you, but to me, male sexual stimulation or just like function is pretty basic and straightforward, right? So if you have, it's an easy button to push if I'm thinking about it, right? Females are a little bit more complicated. There's a lot of things. There's one thing that she said that stuck with me as well, is that sexual arousal comes before desire, which is key for all my guys out there. I was sitting there taking notes for my wife. I was like, so you got to get the motor running before there's even desire to want to do it. And that's why, they always say foreplay, foreplay, foreplay. But that is a proven study. So anyways, she says, how many drugs do you think there are for female sexual health and sexual wellness? 0 up until that point. Now there is one. There is one that she recommended, and then all these other adjunctive devices, right? Here in the South, it's very... people clam up about it. People clam up about talking about sex. And you have to be able to use those terms and be able to talk about it to even start the conversation. Because if I go into a room and there's a lady there and I say, I'm doing my whole, assessment, and you get to the sensitive stuff, like, do you feel safe at home? Are you abused? Any history of abuse? Do you use any illicit substances? And then are you satisfied sexually? Like, how is your vagina? Is it pink? Is it moist? Is there pain on penetration? If I can't say that and not be like, if I can't say that and not be confident, if I can't be weird about it, like if I'm acting weird or shy or like, oh, it's kind of gross, well, then you're not going to open up to me. So I like that she actually addressed the fact that, yes, you have to be able to use the right words. You got to be able to know what to ask for. Because there was, gosh, she's going to hurt me if I don't remember it. But there's a postmenopausal syndrome where basically your vagina ends up being dry and not ciliated. So like, not ciliated is that word. So like there's a bunch of, I can't get into the terms now, but there's a bunch of folds in your vagina. And after menopause, you can end up having dry, inflamed, painful, and let's call it corrugated vagina. And I can't think of the name. And that's so bad on me. I'm so sorry. But there's this thing, and no one asks about it. No one even knows a thing about it. I don't have my license yet, so I'm just going to use that as my out for not knowing it. But if you don't ask any questions about it, you'll never know. Then she put up a statistic that's like 80% of patients want their practitioner to ask the question because they do have questions. They're afraid to embarrass you, the practitioner. So if you open that door, they're going to say something about it. If they're having any issues. Now, you don't have to have all the answers either. You can punt it off to a specialist. That's the whole deal about being a general healthcare provider, is to find these things and navigate the healthcare system. Treat what you can, treat what you know, but also don't be afraid to punt it off to somebody that knows more than you, because there are experts in the field for a reason. You can't know everything. So, that was interesting. That's interesting just because you got to be able to have the conversation. If you can't have the conversation, then you're not getting anywhere. And it was also cool to hear her talk about, like, for lack of a better word, sex toys, okay? And then she calls them therapeutic devices. Basically just vibrators and different lubrications. And there's actually a lot of bad lubes out there for the pH of your vagina. So something to look into if you're like looking into it. Make sure you're getting the, I guess, gynecologist recommended ones. I don't know what they are. Again, I'm not the expert. So I'm just saying, use these things. She gives out, it was like a Trojan vibrator. So she was like, it's $15. I give this to all my patients that are having issues. I even write a script for it as a therapeutic device because especially here in the South, nobody wants to use the word sex toy. Okay. She even talked about a patient that she had one time that because in females arousal comes before desire, there was a patient, her husband had pre-ejaculation, or I don't know what you call that. He went too quick. Let me put it that way. Okay. I forget what everything's called, but he just blew his load too quick, for lack of a better word. The doctor gave the female the vibrator to basically get all the motor running. And when you initiate that kind of therapy, the education is important here because, again, you can't be weird about it, and you have to be able to have an open conversation about it. I don't know if I'm that person to do it, but it's good to know that these conversations can happen and happen well. Because now, that same woman, where it was weird and awkward and she didn't know how to talk to her husband about it, now she can go warm up. That's what the husband calls it now. Go warm up and get everything ready, and they can both now be sexually satisfied. Why is that important for me as a practitioner? Do I really care? I don't care what you do, necessarily. But job is to promote overall health and happiness. A married couple, by God, you are dictated to have a happy sex life, right? Who do you go to for help? Do you go to your buddy Phil? Do you ask your brother? No. This is how weird things end up happening out in the field, right? So like when people use like Crisco as lube, it's because they ask their cousin Joe what they need to be doing to spice it up. No, there is certain things that you can do, and that we need to be able to provide care and practice for that stuff. And it was a good seminar in like getting you all riled up, ready to like make a change and help people out. Because like I said, you're married. You have a right to this. And of course she was like, unmarried people too and all this other nice jazz. I don't agree with all that, but that's a whole nother thing. Then, okay, this is where it starts getting a little dicey, okay? Then she starts talking about what's the right word? Not discriminating, but not being able to help everyone without, I guess, discriminating, I guess. I don't know a better way to put it. So she goes, your job as a practitioner is to help people have healthy behaviors, right? So it's not to judge, I guess is a good word to put it, not to judge. So if they're straight, if they're unmarried, if it's gay, if it's extramarital affairs. And I went, hold on now. I can't put my stamp of approval on that. I have to educate how wrong that is. Is that my place? I don't know. Honestly, I don't. But I can't get on board with that. I cannot get on board with the extramarital affairs, okay? Then she keeps going on, and if people want to have group sex, there's places to do that. If they want to have like BDSM stuff, there's places to have that. And I was like, all right, like, I guess I can't judge, but it's still not right. You should not be doing that. But I get what she's saying about our job is to make sure people are safe, right? If they come with your problem, you open up that door for the conversation, and then you can have an open, two-way communication about what's going down. Then she gets into this whole, I'll say it, she goes, and some people this is exactly what she said. She goes, some people like to have sex with animals. Now this is where the entire room changed, because I'm going to be honest with you, when she first started off, I was like, who is this woman? She came in with like a stuffed vagina, and she was like, this is what I use to teach my patients. Look at all of these toys. I was like, why are we doing this? Why are we here? Then she got into the meat of her presentation, talking about sexual health. Then she gets into not judging and says people like to have sex with animals. This is where you lost 98% of the room. The entire room went, hold on, wait a minute, bestiality is not okay. She goes, well, there's a place in Tennessee that you can like sign a waiver and they make sure you're not hurting the animal or anything. I was like, did the animal sign a waiver? Because I've never seen a goat sign a piece of paper that says it's okay for us to do it, to have sex. Like, I don't think that's how that road works. Then she goes, no, I'm pretty sure it's not illegal. So then, I went on to Dr. Google and I was like, is it illegal in the state of Tennessee to have sex with animals? It is definitively illegal to have sex with animals. Then she starts going, but then here's the thing that kills me, okay? It doesn't bother me that an instructor says something crazy, right? Because you're always going to get told crazy things. There is people out there with ideas that I don't agree with, but they have those ideas. It's okay to have an idea, right? It's not okay to teach the idea, to agree with the idea, and then when you get called out that says, hey, the Tennessee State Code annotated says that it is illegal to do this, you should check yourself up. When you get so much backlash from all the students, almost all the students, we're going to get to that in a moment, you should check yourself up. You should go, whoa, well, maybe I misspoke, something. But she went, no, that's not how that works. You can't judge. The thing that kills me, okay, not only did she kind of semi-stand her ground, there was other students that also didn't see a problem with having sex with animals. Bestiality is not okay. Bestiality, if we can't agree on a few things, okay, we as humans, we have to agree on a few things. You can't have sex with kids. You can't have sex with animals. These are things that are not okay. These things cannot represent themselves in the brain. They don't know enough in their brain to be able to think if that's okay or not okay for themselves. 18 isn't really even that. I mean, you didn't know what you didn't know at 18. Like, you're still really a kid. We call you an adult, but let's be real. You're still a kid. You shouldn't be able to take loans that'll affect you for the rest of your life. You shouldn't be able to put yourself in these situations where you can catch a sexually transmitted disease that might stay with you for the rest of your life. We have great treatments, but that doesn't mean that these treatments cure you. That means they may get rid of all the symptoms. So, If we can't agree that that's not okay, that's a huge issue. And it bothered me because there was a few people that didn't really see anything wrong with it. They're like, I mean, who am I? It is our job to promote health and wellness. It is important that if we can't agree on those, just very few things that we have to be able to stand up. Like murder is not okay. Murder is not okay. It just bothered me. Bestiality was brought up in this seminar, and that's where you lost me. And it wasn't like she didn't know what she was talking about. She was like, no, there's a place that you can go have sex with animals. I Googled it. You can't find it anywhere. And I'm going to be honest with y'all, at this point, I don't know if this is going to actually even be able to stay on YouTube, because I've talked a lot about a lot of things that, I don't know, seem taboo. But it's an open and honest communication that these are things that are going on in our communities. And this is something that was said, this whole bestiality thing was something that was said in a room of doctorate prepared nurses that are practicing currently. So like all of the instructors, and then all of us who are BSN prepared nurses that are, the majority of us are still working because we have to pay for everything because we're poor. This is the thing that like it came up in a room of all of us, and we all weren't on the same page. The majority of us, I think, were. There are people that are even more mad than me. I told my wife when I got home how it happened and what happened, and she was outraged. She's like, you need to report her. I was like, well, should I? I don't know. I should probably report her. I probably should. But she was more outraged than I was. My friend that I was sitting next to was more outraged than I was. They were irate. I did call her out, and I was like, hey, that's illegal. Like, that 100% is illegal. I don't have to pull out my Bible and say that's wrong. I can say state, because, not everyone agrees on the Bible. In the Bible, Word of God, whatever. I'm not getting into that, but there is Tennessee State Code that we're all Tennessee State residents. It says that's illegal, and you didn't agree with it. So, that happened. And that was kind of a big deal. And I don't know what to think, what to feel about that, except kind of outrage, kind of, outrage isn't the right word. I was angry, upset that everyone else wasn't upset. Because it's wrong. It does make me want to stay with the whole nurse practitioner thing, because I want to be the good role model that kind of stands up in those rooms that you have to have this, like, credentialing. If I'm not in that room, who's going to say, hey, this isn't okay? I mean, there was other people, but just in the future, when this kind of stuff comes up, someone has to be able to say, hey, this isn't cool. What we're saying right now is very dangerous territory, and it's dangerously going down this downward slope into chaos and anarchy. That's why it made me feel like I need to stay with a nurse practitioner. Not that I wasn't going to anyways, but it just kind of solidified the fact that someone needs to be here to help stand up for that, to set a good role model and be there to protect our society, our youth, our old people, our young people, everybody. You don't want evil to infiltrate. All it takes is for a good person to do nothing. So, that's it. That's the last time I'll talk about that part of it, okay? Now, with these sensitive exams, I was under the impression that we were going to learn about this stuff and then go and do the actual practical portion, where you, for lack of a better word, check some prostates, check some testicles, do some pelvic exams, check out some vaginas. That's not what happened. Apparently, since COVID happened, we have not had real people that they pay to do this on. And generally, that's the whole thing. Like, I can do this on a model 100 times, okay? Just like intubating. Intubating is a perfect thing because I was a paramedic, all right? So you can practice with your laryngoscope. You can do everything over and over again. Practice is perfect. Practice perfect. Practice perfect. But what you can't do, and I've never seen it, you cannot mimic the feeling of like actual tissue, like the bone, the cartilage, everything. So when you open that airway up, it's a very different thing from the mannequin to the human. And then you also have all the extraneous things, right? So like, are you in the OR? Are the other people really quiet? Are you right next to a bed? Like, there's so many extra things. And talking to the person when you get ready to do the pelvic, not being awkward and weird with that, it would have been nice to be able to have that practice when I'm saying, hey, ma'am, I'm going to give you a pelvic exam. And actually doing it. Not just doing it on a silicone that doesn't have any nerve endings or anything like that. So, that was interesting. We're going to move on past that. I really got on the bestiality thing, guys, and it really did mess in my head a little bit that I was a part of this. So, apologize for that. I do want to talk, I haven't really touched on it yet recently, is my grades. My grades have been pretty good this semester. The only class that I'm having issues with is pathophysiology. And the reason being, the tests are super hard. I'm not the only person that's having an issue. The grade you have to pass in this class is an 83. My grade right now, sorry about that, that was my bad. My grade right now is an 83, like 0.5. So, I'm not failing, but I'm also not doing like super hot. If C's were able to pass, I would be doing great because it'd be like greater than a 75. I like to have a big margin of error. I don't have that. I definitely don't have that right now. So we've submitted a group assignment. Group assignment's turned in. I'm waiting on that grade back. If that grade, because that's a heavy weighted grade, if I can get like a 90 on it, it'll bring my grade up to like an 86. Then I'll be able to breathe. If I get like a 95 on it, it'll bring it up even higher. This week has been a lot because of those sensitive exam skills at the beginning. I worked yesterday. Today, I took the pharm exam, and I got an 88. Come on. Just a minute of celebrate. Ooh, ooh, ooh. Okay. 88 before they give any points back. Thank God. Thank you so much. Next, I have to, because we're leaving Saturday for spring break, I have to do another just like quiz, which is not as bad, but it still takes like 3 hours of, getting it all together. A quiz in patho. I've got to do a shadow health, like fake patient in health assessment, which is going to take like 2 hours. Then I got to write the SOAP notes, which took a few hours last time. And then I think I'm done. I think I have to complete those 3 things. It's Thursday. I would like to be done today. So if I work, pretty late, I might be able to get all that done. If not, I'll finish it tomorrow morning. And then I just got to pack up the car and we can go on vacation. I do not want to do any work on this vacation. We're going to Cherokee, Alabama, and I'm ready to just get gone. Luckily, my mother-in-law is going to be staying here at the house, so don't have to worry about the dogs. Don't have to worry about nothing. I can just enjoy myself. Other than that, guys, the people that I've met throughout the program have been really cool and really solid. Like, I do like the actual other students that I'm with. And a lot of the practitioners I've met have been really cool and solid. It's given me more hope for staying in the medical field. Just because, it's easy to get burnt out. That there's all these other options to do. There's other fields to do. Because I worked peds trauma forever. That's all I did. Or EMS. If that's all you see, that's pretty rough. So just knowing that there's all these extra other options that you can do. Like working in a clinic. I'm doing dialysis right now. I will not be doing dialysis much longer. And I'll tell you more about that later. There's just options. You got options. And it's good to find them and good to find good people in those options. So, guys, thank you for being a part of this ride with me. Share it with a friend. Like, subscribe. You know what to do. We're going to make this like an empire of just goodness. So, guys, remember, always keep your corn on the cob.